Hey everyone, welcome back to Bone Graft Academy. Today we're answering a question that comes up years after dental implant treatment. Can a bone graft fail long after it's healed? It's an important question because most patients think once a graft heals, it's permanent. And in most cases, that's true. A well-integrated bone graft becomes part of your natural jaw and can last a lifetime. But there are situations where changes in the mouth or body can cause bone loss even years later. Let's talk about why that happens, what it looks like, and how to prevent it. First, it's important to understand what a successful bone graft really is. When a graft heals properly, your body replaces the graft material with real, living bone. That bone fuses seamlessly with the surrounding jaw, giving implants or teeth a solid foundation. Once integrated, it behaves just like natural bone. It can remodel, strengthen, and adapt over time. So in a healthy mouth with good hygiene and regular checkups, a bone graft should last indefinitely. However, bone is living tissue, and like any part of your body, it can change under certain conditions. One possible cause of late failure is infection. Peri-implantitis, an infection that develops around dental implants, can destroy the bone that supports them. If bacteria accumulate under the gum line due to poor hygiene, the body responds with inflammation, and that can slowly dissolve bone over time. This isn't a failure of the graft itself but a result of infection in the area surrounding it. Another cause is excessive pressure or bite forces. If an implant or restoration is overloaded, for example, if you clench or grind your teeth, that mechanical stress can lead to bone breakdown around the implant. Wearing a night guard and keeping your bite properly adjusted helps prevent that. Systemic health changes can also affect long-term bone stability. Conditions like diabetes, osteoporosis, or hormonal changes can influence bone metabolism and healing. Even certain medications, such as long-term corticosteroids, can reduce bone density. That's why ongoing medical and dental communication is so important. In some cases, gum recession or soft tissue loss can expose underlying bone and make it more vulnerable. Keeping your gums healthy through regular cleanings and maintenance visits is key to protecting the bone underneath. A bone graft doesn't expire, but it does depend on the environment around it. If the surrounding tissue stays healthy and clean, the grafted bone will remain solid for decades. If infection or stress occurs, that same bone can start to resorb or weaken over time. So how do you know if your graft or implant area needs attention? Common warning signs include redness, swelling, bleeding around the implant, gum tenderness, or loosening of the restoration. If you notice any of these, don't ignore them. See your dentist right away. Most issues can be treated early before major bone loss occurs. To prevent late graft problems, maintain excellent oral hygiene. Use a soft toothbrush or water flosser around implants. Wear a night guard if you grind your teeth, and see your dentist for regular implant checkups at least once or twice a year. It's also smart to maintain a balanced diet rich in calcium, vitamin D, and protein. Your bone remains living tissue that benefits from good nutrition. To summarize, a bone graft that heals successfully is designed to last for life. But infection, mechanical stress, or health changes can cause bone loss years later, if not managed properly. With consistent care, regular follow-up, and healthy habits, long-term graft failure is extremely rare. Think of your bone graft as a living foundation. Once built, it's your job to maintain it strong and healthy. If you found this video helpful, make sure to like it, subscribe to Bone Graft Academy, and share it with someone who has dental implants or is thinking about long-term implant care. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.